The United States spent $5.3 trillion on healthcare in 2024. That is not a response to a crisis. It is the baseline. Healthcare now consumes roughly 18 cents out of every dollar spent in this country, making it the largest industry by both total spending and employment. And by every available measure, it keeps getting bigger.
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello and welcome to Dr. Mercola's Cellular Wisdom. A new report Dr. Mercola reviewed breaks down where that spending goes and what actually drives it higher. The finding most people would not expect is that price increases are not the main culprit. Medical prices rose just 2.5% in 2024, below overall inflation of 2.9%. What's growing is volume. More visits, more procedures, more long-term management, more prescriptions. The system isn't becoming more expensive per service, it's being used more.
Per-person healthcare spending reached $15,474 in 2024, and it has risen every single year since 2000, growing 77% faster than inflation over that period. That money moves through premiums, out-of-pocket expenses, employer contributions that come out of wages, and tax-funded government programs. Dr. Mercola notes that regardless of how it's counted, it comes from people that it just passes through multiple intermediaries before reaching providers, each layer adding cost and reducing transparency.
The polling data tells the personal side of the story. 66% of Americans worry about affording insurance premiums and medical bills. 55% say their health costs rose in the past year. Health expenses now rank as a greater personal concern than utilities, food, housing, and gasoline. Dr. Mercola points out that this financial anxiety has real downstream consequences. It affects when people seek care, whether they follow through on treatment recommendations, and how much bandwidth they have left for the prevention work that would reduce those costs long term.
His central argument is that the structure of the system is not designed to reduce the demand placed on it. It is designed to generate it. More referrals, more follow-ups, more imaging, more prescriptions. Each one reasonable in isolation, but collectively they build a pattern that becomes very difficult to reverse once it's established. The administrative layer on top, billing, prior authorizations, insurance navigation, documentation, adds substantial cost without adding care.
Dr. Mercola frames this not as a reason to avoid medicine entirely, but as a case for becoming a more deliberate participant in your own health decisions. Before accepting a new medication, ask what the plan is for eventually stopping it, or whether non-drug approaches exist. Before agreeing to a recurring appointment, ask what specific markers would indicate the visits are no longer necessary. Before filling a prescription for a symptom that appeared after starting another medication, consider whether you may be treating a side effect with another drug. He notes that cascade one prescription generating a symptom that generates a second prescription, is one of the most common pathways into deep system dependence.
The upstream driver, Dr. Mercola, returns to throughout the analysis is metabolic health. The majority of high-frequency medical care is driven by chronic disease, and the majority of chronic disease is downstream of conditions that are directly addressable through lifestyle. Insulin resistance, chronic inflammation, and declining mitochondrial function are not just health problems, they are the biological inputs that generate the demand the system is built around.
Mitochondrial efficiency is where Dr. Mercola focuses the practical recommendations. When mitochondria are not producing energy adequately, the result is persistent fatigue, poor recovery, and the kind of chronic symptoms that send people to repeated appointments without resolution. Supporting mitochondrial function reduces that symptom burden, which reduces the demand that drives costs.
Several inputs directly support mitochondrial function. Daily sunlight exposure, outdoors and ideally in the morning rather than peak hours, supports the circadian rhythm that governs how efficiently mitochondria operate. Dr. Mercola notes an important caveat. Linoleic acid stored in the skin from years of seed oil consumption increases sunburn sensitivity, so eliminating seed oils for at least 6 months is recommended before significantly increasing outdoor sun exposure. Consistent sleep timing within a 30-minute window every night keeps the cellular repair cycles that mitochondria depends on running properly.
Nutritional inputs matter as well. Adequate healthy carbohydrates provide the mitochondrial substrate the brain and muscles rely on. Protein intake around 0.8 grams per pound of ideal body weight supports overall metabolic resilience, with about 1/3 coming from collagen-rich sources like bone broth or slow-cooked cuts with connective tissue. For tracking, Dr. Mercola highlights 2 low-cost markers: resting heart rate, which reflects cardiovascular efficiency, and HOMA-IR, which reveals insulin resistance trajectory before clinical disease sets in. Both give you a window into your metabolic direction years before symptoms or diagnoses appear on a scan.
Here's the frame worth carrying forward from this. If healthcare spending grows primarily because of how much of the system people use, not just what it charges, then demand reduction is the most powerful lever available to any individual. You reduce your own demand by building the cellular resilience that doesn't require constant management. Drop a comment. What's the single change you've made or are considering that has the most potential to reduce how often you actually need medical care?
Thank you for listening to Dr. Mercola's Cellular Wisdom. See you in the next episode.
Looking for trusted health wisdom you can hold in your hands? Discover the life-changing books of Dr. Mercola at joyhousepublishing.com. These titles bring decades of natural health research into practical steps for better energy, stronger immunity, and clearer thinking. Take charge of your health with guidance rooted in science and experience. Visit joyhousepublishing.com now and claim your bonuses while they are available.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.